Hello, Melbourne. It's a real delight to be broadcasting to you today from Sheffield in the north of England. My name's Jamie and I'm the director of the Mindfulness Initiative, which is a think tank, a policy institute, which came out of a teaching programme for politicians in the UK Parliament, where since 2013, 185 MPs and members of the House of Lords have been on an 8-week mindfulness course. So I find it helpful, even though I've been working in this area for a while now, to hear different definitions of mindfulness. So if you're a practitioner already, then bear with me. But we describe mindfulness as a natural human capacity. So something that we all have to some degree, some of the time. And it turns out those who tend to be more mindful also tend to have more resilience to psychological distress, more satisfying relationships, better decision making, or resistant to common cognitive biases, and we can choose to cultivate this capacity consciously, normally through a training course. Although it seems there are many ways to do it. So what is it? It's the ability or the intention to pay attention on purpose to what's going on right now in your mind, in your body, and the world around you, with particular qualities like openness, curiosity, and care. So our mind tends to wander off into the past and into the future, which is helpful much of the time, but it's about having the conscious choice to be present with who you're with the task at hand, or just sort of smelling the roses when you want to be, and that requires training. It's like it's a little bit like building a muscle, the ability to pull yourself back and anchor yourself in the present where your body is, to get more information to learn and grow from. So these training courses for mindfulness can be accessed by the public, in the public domain, for just flourishing, well-being, performance at work. But in the clinical environment, the evidence base is largely around mental health concerns, common mental health disorders like anxiety and depression. So that there are thousands of papers out there looking at the implications of mindfulness training. Largely these papers are sort of pilot or feasibility studies, early bits of work low down the evidence hierarchy, but in some cases there are strong randomized controlled trials and meta-analyses looking at many RCTs combined. So these have been looking at particularly mindfulness for recurrent depression since the late 1990s. And one form of mindfulness training for this purpose, mindfulness-based cognitive therapy, has been available on the UK National Health Service since 2004. So it is a recommended, actually it's a mandated and a priority treatment to help people stay well after they've been depressed 3 times or more. And there is good evidence to recommend mindfulness training for the treatment of other common disorders like anxiety and some long-term physical health conditions like pain, like living with cancer, and things like IBS, irritable bowel syndrome. So mindfulness has been available for getting on for 15 years now. However, it is still not that accessible to most people around the country, for whom antidepressants tends to be the only option to make sure that they stay well. So recommendations we've made over the last few years, some of which have been acted upon, are seeking to widen that access. So mindfulness, in the last 12 months, 18 months, mindfulness-based cognitive therapy has now been made a mandated therapy across England, alongside CBT, to give people more of a choice when managing their depression. So we need more evidence. we need more funding to look at some other applications. There's promising stuff in the applications to PTSD, to psychosis, to living with HIV, to psoriasis, to working with adults with autism. So the popularity of mindfulness publicly and in the workplace sort of grew exponentially in the UK and most places in the Western world over the last few years. And it's now the case, I think, that most big employers will have some kind of mindfulness training program. So one of the things that we do, the Mindfulness Initiative, we hold a network of private sector champions, people who are trying to share mindfulness with their colleagues in their workplace, and represented on that group are the likes of Google and HSBC and Jaguar Land Rover, Ernst & Young, GSK, GE, and in some of those cases they have full-time members of staff who are responsible for overseeing the mindfulness program. And there are three general sort of areas of benefit that are driving this interest. The first one is in resilience, mental health, and well-being. Second one is around sort of performance and cognitive skills, and the third one is around emotional intelligence, empathy, and relationships. So I just want to focus now on how mindfulness training is being used in the clinical context, or clinical workplace context. So there are a lot of issues around the high levels of stress that doctors are under, and particularly junior doctors. So my thoughts go out to you. And it seems that mindfulness helps with like resilience and sort of psychological well-being. So there's one study that has been done recently in the Scottish in the National Health Service in Scotland, using sort of a few hundred participants. So this is NHS staff, and it seems that those who were judged to be of having good resilience went from about 30% to 2/3, over 60%. So these other two areas are performance and cognitive skills. So this is sort of attention control. I mean, we're finding that because of the way we're using our phones, because of the way we're using social media and other media, we're struggling in ways we weren't before to pay attention, and mindfulness is one way to shore that up and actually to boost our focus to the extent it becomes a bit of a superpower. Other things that fit within this performance and cognitive skills domain include working memory. So this is really important for learning and decision making, and mindfulness practice seems to boost this, but also perhaps more importantly, sort of mitigates or protects us from stress-related erosion of working memory. So for those working in A&E or high-stress medical contexts, it's a little bit like those going on deployment as soldiers. And what they found there is that over your 6-month deployment in a conflict zone, living under sort of constant threat and stress, over time, working memory degrades. What we can hold in our minds reflexively is reduced, and we make worse decisions, and perhaps that has implications for life and for harm, as it may do in an operating theatre or in an emergency room. So that's the second area, and then the third area we have sort of emotional intelligence, compassion, and relationships. Again, really important and for a clinical environment, and this is where perhaps we've seen most interest grow in the UK. So a few years ago, we had a couple of hospitals where the level of care really broke down, and this led to the term compassion fatigue being used, which I have some issue with, because there's a difference between empathy and compassion. I think empathy, and this has some evidence to support it, empathy, you can get fatigued through because it's exhausting to really be feeling what the other person's feeling. But compassion is actually an energizing, kind of joyful feeling, and is infinite and is abundant. And so a training like mindfulness, which helps us to explore these capacities and consciously develop these capacities, can help us to discern the difference between those two, and to cultivate one, and know when the skillful way is to use the other. So yes, we had these scandals in the UK. Compassion is more than ever being put at the centre of care. And in other countries, like in Holland, I've seen recently there's been a vision document about who they want their clinicians to be, and this has really put sort of coaching and individual presence and care and emotional care, no matter what your discipline is, at the centre of the clinician's skill set. So our oldest think tank in the health space, the King's Fund, has been going for 120 years, has a mindful, compassionate leadership program, or compassionate mindful leadership program, for senior leaders within healthcare settings. And then across the UK, those trusts that have successfully set up mindfulness-based cognitive therapy services for patients are also teaching staff. So now there are thousands of people in the NHS every year volunteering and wanting to go on mindfulness courses. But it's really early days, given 1.5 million people work in that system, and so it's a real sort of scratch on the surface. And what's needed now is evidence. And so a number of these NHS services are looking at developing an evidence base to show that mindfulness helps to meet some of the real needs of staff working in this area. And so I'd like to finish just by acknowledging that in many other countries, actually, there's a lot more work being done in this area, and to pay credit to Dr. Craig Hassed of Monash University Medical School, who has been teaching medical students for 30 years and runs the world's largest online MOOC, introducing people to mindfulness. So that's one to check out if you would like to start. And finally, to say yes, good luck, and look after yourselves. It's really important to make sure that you have the cognitive and emotional resources required to hold so much distress that you will come in contact with. So much respect and good luck.